Good morning. This is Lisa Grennan, Family Program Manager with MWR, and we're going to get started. It's 11:30. I would like to introduce you to Melissa Engle. Melissa is a certified clinical trauma professional and master certified accelerated resolution therapist and provides counseling and clinical supervision. Melissa is currently completing her PhD in counseling and is studying moral injury, accelerated resolution therapy, and PTSD. She's a has expertise in PTSD, post-traumatic growth, moral injury, and veterans issues. She presents at local, state, and national and international conferences, and we are so excited to have her with us today. She believes recovery is always possible, and even though it may be discouraging to know that trauma changes our brain, she knows that so does recovery. So, the other thing I just want to address is anyone on the phone today, if you would want to email us at mwrbattlecreek@dla.mil, we will add you to our list and just to so you can get a copy of this PowerPoint. If you email in, we will certainly send you a copy of the PowerPoint we're following today if you cannot see it because you're on the phone. And if anybody wants more information, if you go to mwrbattlecreek.com and programs and services and click on family programs, there's a veteran resource page and it has a plethora of resources for veterans, and we're always adding to it. So please feel free to use that as well. And without further ado, Melissa, if you want to take it away, welcome.
Okay, thank you, Lisa. I appreciate the warm welcome, and I'm really excited to be here. I think this is my third year in a row coming in June and speaking to your organization, and it's honestly one of the highlights of my year because it really causes me to come up with some new information and challenges me to try to look at what you guys might be wanting or needing and then to meet those needs. So, I'm going to go ahead and get started and walk through. If you have any questions, feel free to type them in the chat. I will eventually get to them and welcome your questions. So here's a picture of me. Not that that matters, but I don't get to see any of your faces today, so at least you can kind of see my smiling face. Um, and I've been a therapist since 1998. When I first entered the field of behavioral medicine. And I have seen a lot of medications, treatments, theories come and go, and some last and some don't. Some get real, as I like to call them, kind of sexy and popular. And so we're going to talk about all of those things today. We're going to first go through some of our objectives that I have for the next hour. First of all, I want you guys to understand what the symptoms are of stress and anxiety and understand kind of what's normal and what's not, and what might be symptoms of something greater like post traumatic stress. Then, what I'm going to do is I'm going to walk you guys through an exercise to learn how to desensitize yourself to any disturbing images that you might have been holding on to. It's going to be a fun but brief exercise. Then we're going to go through the different types of treatment. I'm going to start with kind of standard treatments, evidence-based treatments. And when I say evidence-based, what that means is that there's been a significant amount of research and data done on a treatment, and that there's, proof through the research that it's an effective mechanism for assisting people. And then I'm going to look at some non-medical treatments, and then I'm going to teach you about some new or novel treatments for PTS. Now, when I say new and novel, they may or not be, kind of evidence-based. Some of them are pretty new. Some of the research is ongoing, and some of the long-term benefits aren't yet known just because they are new. And I'm imagining at that point, you guys are going to have a lot of questions. And then I'm going to give you some resources on how to find these types of providers. So let's say you learn about one theory today and you really like it. Well, it doesn't do you much good if you can't find a connection with someone who can provide you with that service. So I've got some resources on here. So I highly recommend, if you can download or get a copy of this webinar at the end of today, to do so. It's going to also have my contact information. So if you have any follow-up questions, anything that you want to ask, privately, feel free to reach out to me either by phone or by email. I'm happy to take your questions and get you assisted or linked with the care that you're looking for. I just want to take a moment to acknowledge the impact that post-traumatic stress has had on our society. What we know is that at any given time, about 8% of our population meets the criteria for post-traumatic stress disorder. And that's fairly high considering some levels of other mental health conditions. For example, bipolar is about half as frequent at the most. So it's a common problem. It's something that I specialize in my practice. And there's a lot of options for getting care. But what we do know is that PTS is treatable, it is possible to recover. And I assume that the reason why you're here today is because you or someone that you love might be struggling with some of these problems. So, my goal today is to help you feel informed and empowered so that you can be sort of a smart shopper for yourself or for your loved ones or for your family. Okay, so I want to get everybody kind of in the mood and to kind of feel what treatment might look like for learning how to cope with post traumatic stress. All of us have had life experiences at some point that are profound, that impact us deeply, and they can be very wonderful moments of joy and very devastating moments of grief or loss or pain. Many times, those memories that we have will be connected with certain images. We like to call those images snapshots. All of the older folks in the room, me included, will remember Polaroid cameras. I think they're coming back these days anyways, so maybe the younger folks know what they are too. But our brain kind of has these pictures. So what I'm going to do is just ask you guys to, kind of pull the chair away from your desktop for a minute, put the phone down, don't multitask, just get yourself comfortable in your chair. If you're driving, please don't close your eyes. Don't get too comfortable. You might not be able to do something like this, but otherwise, if you can be seated and be in a relaxed position, I'm just going to invite you to visualize some things, and there's no risk. There's no harm to any of this. It's not going to get you amplified, I promise. Everything about today is going to be good, fun, positive information. So, if you found a comfortable spot, you've taken your distractions away, I want you just to close your eyes and I want you to imagine a dinner plate with your favorite food. Just take a moment to look at the color and the texture of it. And just imagine and visualize your favorite dish. For me, it's pizza. Now you're probably all imagining pizza, and that's okay. But go back to your favorite dish. And now, what I want you to do is, I want you to take that picture that you have in your mind that's in color, and I want you just to flip it to black and white. Notice when you do that, the food looks less appealing. Maybe now you're not so hungry for it, and it just doesn't look as good. So go ahead and flip it back to color. And there it is. That's that yumminess that you want. Now, what I'm going to ask you to do next is just to imagine a place. Maybe it's a place that you've never been, or a place that you have been to that's your favorite place on earth. Some place where you can imagine yourself feeling comfortable and relaxed and at ease. And I want you just to imagine that place, just for a moment, like a photograph. Now I want you to do the same thing. Turn it to black and white in your mind. Just notice how it doesn't feel the same. Now bring it back to color and focus on the detail. Maybe there's greens or blues, whites or red. Just notice the whole picture from top to bottom and from left to right. Taking it all in and giving yourself just a moment to take a deep breath and think of that favorite place. Maybe that place you want to go someday or go back to. Just notice your body right now, that it's more relaxed than it was a few moments ago. That feels good. And when you're ready, open your eyes, settle yourself back into reality, and I'll get back to that PowerPoint. That exercise that we just did together is something that I do with my clients when I'm helping them deal with traumatic images that are stuck in their brain, these pictures that they want to get rid of, these moments of horror or terror or disaster. And when we can remove the color, we can shrink it, we can change the image. We can even sit in a movie theater and see that image projected far away from us to give us the distance. And that distance allows us to change our experience of the arousal that it brings. And that's really how desensitization works. And many PTSD therapies out there work on that basic mechanism of getting you to see that thing that happened, but seeing the images and those sensations and feeling them differently. So thanks for taking that little journey with me. And I see, Don, you like prime rib, so that sounds yummy. And if you found that task to be easy, I can change things from color to black and white, no problem. You're probably a very visual person, and that means you're going to be really great at some of these therapies that rely more on images than talking. If that was difficult for you to see in pictures, that's okay. This is one of those things that sometimes you need to practice for a little bit. So I would just encourage you to take something around you in your environment and just kind of practice that. We call that dialing it down. And so when we have those distressing images or those stuck snapshots in our mind, sometimes if we can shrink them, if we can turn them to black and white, they don't feel so bad and they feel a little bit different. So thanks for taking that journey with me today. Okay, so let's first and get started talking about what's normal, right? Is it PTSD? Is it anxiety? Is it stress? And how do you know the difference? Well, it can be very difficult, even for a professional sometimes, to identify what's actually happening with a person. But let's start with some terms and then go from there. We've all experienced stress, and we're all experiencing some level of stress. I've got an electrician at my home right now. I'm wondering how much it's going to cost me. Are they going to be able to fix the problem that I'm having? And maybe you have other stresses about work right now, tension or feeling like you're pulled in another direction. Or maybe there's a relationship in your life right now that isn't where you want it to be. But stress itself is normal. Stress is just our body's response to anything that can cause tension. So the goal is not to avoid stress. I mean, we should try to avoid unnecessary stress, but the goal is to understand what is stress and then find ways that we can get some relief from that stress. Now, these stresses and our capacity for handling them, that's typically called our resiliency. And what we know about resiliency is it's something that you can build through positive self-talk, through affirmation, through mindfulness, through meditation, through prayer, through journaling, and through therapy. We can improve our ability to tolerate stress. In fact, it's exposure to stress over time that builds that resiliency. It's that attitude of, okay, well, I've had worse days and I got through those, so I'll be able to get through this. It creates a sense of self-efficacy, meaning that we believe in our ability to handle things. And that's really what resiliency comes down to. In my work as a therapist, I find that many people will often not recognize the traumatic experiences that they've gone through in their own lives because it doesn't meet an expectation or an idea of what trauma is. So when I say traumatic event, you might think car accident, you might think cancer, but a traumatic event could be anything that to the person is highly distressing. So it could be things like divorce, moving, job changes, being fired, You might not think of those things as traumatic, but depending on your resiliency and depending on how much chronic stress you have, and actually depending on some of your genetics, your likelihood to respond to trauma in a prolonged way is a factor that all of those things relate to. And trauma is kind of unavoidable. At some point, we'll experience it. There'll be a car accident, we'll get an illness, loss of functioning or independence, maybe as we age. And all of those changes can be traumatic. Even positive things can be traumatic. I remember when my daughter went off to college, yeah, that felt a little scary for the first time to not have her in my home every night. I wouldn't necessarily say it was traumatic, but it was difficult to get used to and to adjust to, for sure, at least initially. So the bottom line is that stress and trauma are actually really normal things, and they're not avoidable. And it's really about how we interact with it and then what we do after those experiences that determines whether or not it's going to turn into a bigger problem. So when we look at when does stress or chronic stress or anxiety, when does that start to become something else like post-traumatic stress? It's when you feel a change in that personality of yours or in your mood that lasts for 2 weeks or more after the event. If it's not starting to get better, if it's not trending better, or if it's persisted now for months, it may be more serious and it does require evaluation and treatment. What we know about post-traumatic stress is that the sooner we can get to you after that traumatic experience, the more likely you are to not develop post-traumatic stress. And it can prevent the development of it, and it can be treated right initially. And those interventions are often very brief and very effective. But most people who have PTS, they wait an average of 11 years to seek help. And in that time, their behavior has changed, their socialization has changed, maybe their avoidance has gotten a lot worse, and their view of themselves and the world can become very dark. So, PTS by its nature causes avoidance. So, it's not surprising to me that we would wait sometimes a long time to get help. But you guys, I think, mostly have benefits if you're employed by the federal government. So you should have access to really good and affordable healthcare through your healthcare plans. You also have services within your agency for support. So if you're going through something, or if you recently went through something and you're not sure how to get help, maybe start within your work environment and talk to your primary care doctor or directly contact a therapist based on some of the resources that I give you. Just one of the most important things I want to urge to you today is that it might not get better over time. It might actually get worse over time. So if you can deal with it now, you can prevent a lot of the chronic health problems that come from living in a state of really high and amplified post-traumatic stress symptoms. What we know is that PTS changes the brain and how the brain works. It changes our levels of positive hormones. It increases our stress hormones. And those stress hormones that are high for long periods of time have been linked to things like cancer and heart disease. So if you care about your physical health, then your mental health is equally as important, and sometimes is the key to getting you out of a loop where things become much worse over time. Now, I just want to take a second and just see if there are any questions off of the information that I've given so far. And just go ahead and type those in the chat, and I'll give a moment for that. And then I'm just going to encourage you guys to read a little bit more about what PTSD is while I wait to see if there's any questions. Okay, I'm perfectly clear. You guys are great. So I'll keep going. So this is what PTS is. It's a re-experiencing of the event by having intrusive thoughts, senses, or memories of the traumatic event. And when we have that re-experiencing, that trigger that brings up that memory, we have that experience in the form of sensations in our body. Sometimes it's sights, smells, images, or even tactile sensations that can come back. And a normal adaptive reaction to that is to avoid the things that cause those negative symptoms. And so that's what happens over time with PTS is the folks just stop going places that they find trigger them. And then if they try to go back 5 years later or 10 years later, it can be really hard to approach that situation because that avoidance and that fear that those symptoms might come back can really isolate you. And as you avoid and as you isolate, things tend to not improve in your personal life in some ways. And so if there's an opportunity for you to get help, I just want to encourage you to do that. Okay, Stephen, I've got your question. Do you think a PTS recovery program for military reintegrating after deployment should be a requirement? I think that it should for combat deployments, absolutely. Anybody who's exposed or in a dangerous environment or in a combat zone, even if they're not combat deployed or in an MOS that puts them as a shooter, I think that we should be teaching resiliency training. The military has their own version of this, and the resiliency training that they've developed, I believe it's with Cornell University, is really great. It's not always a requirement, and the training is not always done after. Sometimes it's done before. But what they're finding is, and what they're doing with the DoD, is they're putting people now kind of in those deployments to try to work with those individuals so that they're not going home with those problems that are being unaddressed. And frankly, I've talked to so many veterans that have had experiences where, oh no, you filled out the PTSD screening with a yes, now you got to go to medical. Oh, great. This person can't handle what's happening. And there can be a lot of social pressure to not say anything. So it can be hard. There is a reluctance to seek help. There is a mindset that it's a sign of weakness to get help or to have problems with what they've seen or done. And the reality is it's not got anything to do with weakness. But I agree with you, Don, that it could help slow down the suicide rates because the stigma for getting help and the culture within the military itself has got a long way to go. But our culture in general has a long way to go. I don't really think it's a military problem. I think it's a society issue. I will tell you that I am a person myself with post-traumatic stress disorder. And so that's why this is a personal issue for me, but it's also really important for me to share that with people just to normalize it because there is stigma around that. Oh no, are you going to shoot everybody? What's wrong with you? You've got post-traumatic stress disorder. Are you going to, go ballistic or something? And there's also kind of this idea that mental health isn't as important or as valid as physical health. And sometimes we mean to be helpful to other people by saying, well, hey, just try to adjust your attitude or read this book or watch this podcast or, go to church more. And people will give other folks suggestions, but they can be very reluctant to suggest therapy or professional help. But I look at it this way. If I'm a runner and I want to get good running shoes, I'm probably not going to go to Myers and just pick up the first pair of tennis shoes. I'm going to go to a running store and I'm going to ask an expert with my feet and my arches, what shoes should I need, right? I'm going to go to the person who can help give me the product or the service that is actually knowledgeable about it. And that's why going to therapy really should be considered quite a normal thing. And I think there is an idea out there that people think that they're not sick enough or crazy enough to go to therapy, or if they do go to therapy, then they're going to get labeled as that, and it could affect their careers, or especially while they're active duty. There's a huge fear about seeking help. So, yeah, Angela, it is a society issue. We all need to come to terms with not shaming people for their mental health issues, especially when 8% of our population has post traumatic stress, and 20% of us at any given time are suffering with a mental health disorder. So we've got 1 out of 5 having a current mental health condition, and less than half of them actually seeking help. So those barriers are internal and those barriers are societal, and they're also systemic. It can be hard to find good help. It can be hard sometimes to find adequate experts or professionals, and not all therapists are the same. So it might be a little bit of a journey, just like you might have to take your car to a few different shops to find a really good mechanic. I kind of like that analogy when it comes to therapy. It's really important for you to find somebody that you feel like you can talk to, that does understand and gets it, and that is knowledgeable about the problems that you have. That's going to give you the best possible outcome in the long run. Okay, so this is what the cycle is of post traumatic stress. First, you see there's some sort of re experiencing, which leads to an avoidant behavior or a shutting down, a numbing, a not feeling anything. And then there's periods of hyperarousal. And hyperarousal is feeling agitated, feeling jacked up or amped up, feeling like you can't sleep or relax or calm down, or even feeling very vulnerable in a relaxed state. I used to run retreats for veterans, and I could tell how they were doing very easily. I would take them outside into a big open field, and I would have them lay in the grass and close their eyes. And I would say, "How hard is this for you? How safe do you feel?" And all the veterans with PTSD would say, "You got to get me out of here. I don't want this. This feels really bad." Right? Even though they knew they were in a safe, remote location with me in the woods, the idea of laying there, being exposed, and having their eyes closed felt like a loss of control. And that loss of control is a reaction in their body that they're experiencing that tells them, get up, get out of there, get away, right? It's that fight or flight reaction that we hear so much about. And that is an active part of what's happening within our own nervous systems. So let's start first to talk about non medical treatments. Let's say you hate doctors like I do. You don't want to go to one, right? Well, there are things that you can do to begin to decrease your stress and your anxiety. Yoga is one of those things that we have found that people had reduction in their PTSD symptoms. Many VA facilities now are offering warrior yoga or some sort of yoga in the community. The vet centers are also really big on providing yoga services. But it really doesn't matter what kind of yoga. It just matters that you're breathing, that you're focusing on your body. And brain scans show that doing yoga actually changes your mind and it improves your ability to relax and feel safe in your body. We've also found that just doing deep breathing, yogic breathing is just sort of like a meditation with breath. And you can Google it, you can go on YouTube, you can find samples of all of these things. You can find all kinds of yoga videos online. There's even yoga for PTSD videos that you can find on YouTube. They're free, they're open source content. You can do it from your home. If you want to see if you can kind of battle this on your own, these are some of the things that you can start to do that might give you some benefit and some help. Neurofeedback is also a non medical treatment that's been found to be effective in treating that hyperarousal and difficulty focusing. So it works really well for PTSD, but it also works really well for attention deficit disorder. And neurofeedback, if you've ever seen it, they put electrodes up to your head and then they have you use your mind to move things left and right like a ping pong ball on a computer screen. And it teaches you to focus and to center and to calm your mind. And those are things that can be really, really helpful that are considered non medical. There are other things that we can be doing. We've known for decades about the positive benefits of exercise. Now, exercise can be difficult if you've got chronic pain or injuries. So it's important, obviously, to consult with a physician or take things at a pace that feels comfortable for you. But anything that you can do to get your body moving, when your body starts to move, especially when you're walking or running or riding. But when you're moving your legs and you're moving in space, what happens naturally is our eyes go back and forth to the sidewalk, to traffic, to what's around us. And when that motion starts to happen with movement, the looking and the walking, or that movement in general, it actually deactivates our amygdala. And the amygdala is a part of the brain that really controls our emotional arousal. So if you're feeling upset, it's why going for a walk and cooling down for 5 or 10 minutes could make a big difference. So if there's nothing else you take from this, next time you're feeling really stressed out, move out of that room, get out of that chair, put that phone down, and just go for a walk. It could be 15 minutes only for a day. It could be broken into 5-minute increments 3 times a day if walking is difficult for you. Any amount is going to be beneficial towards your mood, for your sleep, and to decrease your anxiety. Meditation, there's 1,000 different ways to meditate, from the kind of classic Buddhist meditations to more guided meditations, just focusing on our body, or more mindfulness related. All of those can get us sitting, reflecting, and focusing in on our inner body and in our inner world. And that's really important when we have post-traumatic stress, because we tend to focus on everything outside of us, like what's going to happen next, what are they doing, where are they sitting, who are they moving to, who's over there, what's that noise. And we're always aware of our environment, and that sometimes kind of dials down our awareness of our own body. And that's why things like yoga or meditation can be really beneficial. The other thing that you can do that's considered non-medical is go to therapy. You don't have to take pills when you see a therapist. You just have someone to talk to get things off your chest, someone to listen. And not all of us have really good support systems. We might have one person who's supportive, but maybe they're going through something. Maybe we don't have anybody who's supportive. Maybe we have people in our life that are kind of toxic for us and harming us or abusing us or affecting our peace and our well-being. Having someone on our side looking out for us is a really great asset to have. Another thing that we found is that volunteering or mentoring for a cause that you believe in, giving in and leaning in and helping others, is a fantastic way to get you out of your own head, out of your own problems. And it can leave you feeling very grateful for the opportunity to bless someone's life or to be a benefit to them. And I've seen research studies about volunteering that have shown that volunteering was just as effective as medication and therapy at relieving and reducing anxiety and stress. That feeling of having purpose, of finding joy, of having value is a really important need that we all have as human beings. Okay, how does protein help? Well, what we found is that having protein before bed, Cynthia, that helps us to sleep better. So a protein-rich snack like nuts or peanut butter or cheese before bed can actually help our brain to recover and give it the proteins that it needs to clean itself while we're sleeping. If you're having sleep issues, that is probably the one place I would advise you to start. There's a ton of information on the internet about how to improve your sleep, but eliminating stimulants, no more Rippets or Monsters or Coke, high sugary foods and drinks should be gone, and eating more protein and less carbohydrates have been found to reduce anxiety and stress and improve sleep. So that's why sleep is so important. It is probably the most important thing that you can do. And I would say every single person that I talk to with post-traumatic stress has some difficulty with their sleep. Whether it's intermittent or not, there's chronic sleep issues. And without treating that sleep issue and that hyperarousal, it can be really hard for your body to reset and for your brain to reheal. So let's talk about all the different options. So let's say you're shopping for treatment and you want to know, what are the different types of therapies out there? What are the advantages? What are the disadvantages? And what are they like? That's what we're going to talk about now. So individual therapy, especially trauma-focused therapies that are well-researched and evidence-based, include the following: cognitive processing therapy, or CPT. I've also got prolonged exposure on there. These are the two main recommended treatment protocols for PTSD that the VA and the Department of Defense use. This is their go-to. So if you seek care there, they're going to try in their mental health clinic, for if you're in the PTSD clinic, to put you into one of those programs. Now, CPT is a type of cognitive behavioral therapy that has been shown effective to reduce the symptoms of post-traumatic stress. Treatment typically lasts for about 12 weeks. And in that time, what you're going to do is you're going to focus on that traumatic event, and you're usually going to make audio tapes. The audio tapes are going to be, this is a story of what happened to me that day. These are the things that I saw, I smelt, I felt, I touched, I tasted, and I remember. And you will record that and then listen to it over. And there's writing exercises. You might also have to write the whole event down in detail. It's considered an exposure therapy. And one of the things I just want to mention about exposure therapies is many veterans that I've worked with do not like exposure therapies. The idea to sit there and live in those worst moments can be really overwhelming and can also cause what we call secondary or re-traumatization. So you really have to be informed and be ready. And what do I mean by ready? You need to be able to relax your body and calm your body, because this therapy is going to make your PTS a little bit worse before it makes it better. And so that's just sort of start slowly if you're going to go into CPT, and really focus on how to relax, how to calm, how to soothe yourself before you begin an exposure therapy. That way, if you walk out of the office after talking about that traumatic event for 45 minutes straight and you feel really amped up, you have some tools and some skills to know what to do and what healthy things to do to kind of bring yourself back down again. Prolonged exposure therapy is also a type of cognitive behavioral therapy that gets you to gradually approach those trauma-related memories. Most people want to avoid those things. And so in doing that avoidance, it can reinforce their fear. By facing what has been avoided, a person can decrease the symptoms of post-traumatic stress. But again, exposure therapies to some clients can be highly traumatic to re-experience. Most inpatient PTSD programs are going to function from one of these two models. And like I said, the PTSD services with the Department of Defense or with the VA are going to also utilize these methods as a first choice. They've got the most research behind them, and they have done lots of work to show that they're beneficial. But in the research, one of the things that you'll notice is that there's a high dropout rate. And so if you've got somebody who's been really reluctant to get help and they're very fragile emotionally, popping them right into some of these programs might feel really overwhelming for them to just kind of dive in deep. But there are folks who want that and who need that and who can benefit from that. The people who complete these programs, more than half of them will no longer meet the criteria for PTSD. So if you do one of these programs, there's a greater than 50% chance that you're going to get rid of your PTSD, which is really, really great. So I don't practice these because my personal experience with exposure therapies is that, yes, they work, but other things work and they're easier to tolerate. So I look at it like this. Like, let's say you need a medication. I can give you an injection or I can give you a pill. You'd probably prefer the pill over the injection. So if your preference is to not be re-traumatized, my preference is to assist you in that. And that's why in my own practice, I don't practice any kind of exposure therapy, because of that chance that it can make things worse, or it can cause a person to not want to come back, because therapy feels like it sucks sometimes when you're focusing on all the terrible things that have happened to you. Just give me a moment to take a drink here. And I'll stop if there's any questions about exposure therapies. Okay, I don't see any questions, so I'm going to keep moving forward. Now we're getting out of the exposure therapies and we're getting into more evidence-based standardized treatments. Cognitive behavioral therapy has been around for, 50 years. And it focuses on the relationship among our thoughts, feelings, and behaviors. So it looks at the current problems and symptoms and helps you to change your thoughts about it, which lead to changing your feelings, which lead to changing those behaviors. Treatment typically will last about 12 weeks as well. And there's often writing assignments and homework assignments associated with cognitive behavioral therapy. You might be tracking your mood. You might be tracking your thoughts that have contributed to that mood. You might be looking at, do you have a problem with catastrophic thinking? Do you have a problem with distorted thoughts? Is your worldview one that causes you to feel more negative about your situation? And so it works on that attitude and that perception, and then helps with then ultimately changing the feelings and the behaviors at the end of it. And there's a ton of data that cognitive behavioral therapy is the most effective intervention for depression, and it's been shown to be highly effective as well for PTS. And it's a component of those exposure therapies, but on its own, it doesn't really dive in and focus on the trauma, but more your thoughts, feelings of how that trauma is affecting you in your daily life. So that can feel a little bit more in today and with getting you help with the areas that you're struggling right now. The next therapy I'm going to talk about is eye movement desensitization and reprocessing, or EMDR. EMDR is a therapy that's given 1 or 2 times a week for a total of 6 to 12 sessions. Now, this model is going to have you pull up those past disturbing experiences, but you're going to pull those up at the same time that you're doing bilateral eye movements. And the reason why we do those bilateral eye movements is because it helps to deactivate and to sort of shut off that fight or flight mechanism. So you can sit with those images or feelings or sensations without experiencing them at the same level of arousal. And so EMDR has been shown to be highly effective for PTS, and it's something that's readily available as well through the DoD and through the VA. And it's very easy to find an EMDR clinician just about anywhere now that it's been around for, I'd say about 25 years. In the early 90s it came out. So there's some other things that work besides therapy. Standard Zoloft, Paxil, Effexor, and Prozac all have supporting evidence that they help reduce the distress of post-traumatic stress. Now, with any medication, they can have side effects. They can cause weight gain, sexual dysfunction, and stomach issues are fairly common. And they also might need to be continued indefinitely. So that's a disadvantage, that there's some risk involved with that. But there's also the advantage of relief without having to spend a lot of time going someplace and talking about those things. It just kind of helps your mood to be a little bit lifted. So that's something that you can consider. And again, the DoD and the VA use those same, sorry, my computer locked up here. Let me go back. They will also often prescribe those medications. So if you go there and you say, I'm having PTS and I want medication for it, expect that they're going to put you on one of those 4 medications. There are other medications that have been used off label, such as Inderol, antipsychotics, other beta blockers, mood stabilizers, but they don't have any real evidence that they've been proven effective with post-traumatic stress. It's just some doctors have seen some patients improve with addressing some of those other issues by different types of medications. So there are medication interventions, but what we know from 70 years of mental health research is that yes, medications work. Yes, therapy works. Medication and therapy together tend to work better than just one or the other alone. A therapist will tell you, I think, your problems are not getting better through therapy, and recommend medication later. Most of them will try to help you with the least invasive, least risky intervention. So they'll start you with therapy, and then if you don't improve with therapy, that's when medications are typically going to be indicated. So let's talk about the new or the novel treatments, and this is where I think that we can have some fun, because I'm going to talk about some things that you guys have probably been like hearing a lot about on the news or on TV or on the radio. Now, they're called novel because there's a lack of adequate research. The little research that's been done looks great, but one study with 27 people is not necessarily generalizable to the whole population. So I don't necessarily completely endorse these. I can only tell you about the ones that I've had personal experience with, and I can only tell you to kind of keep looking and keep kind of checking in on these therapies to see if more studies come out that may help support the fact that they are really, really good interventions. But what we see with these new interventions is that they're focusing on the brain instead of focusing on our personality or our identity or our coping skills. They're more brain based interventions meant to heal that trauma, which is like an injury to our brain. So, the one that I'll talk probably the most about is accelerated resolution therapy, or ART. ART uses relaxing eye movements and a technique called voluntary image replacement to change the way in which the negative images are stored in the brain. So, what I'm going to do first, before I talk about how these brain interventions work, is I kind of need to give you a mini neuroscience lesson. So, I'll try to make it as brief as possible. But what we know about memory is that it works differently than probably you or I, and how we learned about how memory works when we were in school. Memory used to be thought of as like a library, and you would go to a book, say it would be called fourth grade, and you'd pull it out, and there's your teacher and your friends and the name of your school and where you went on family vacation that year. And then you pull it out, you look at it, and you go, yep, I remember those things. We put it back on the shelf, and it's unchanged. And we used to think of our mind as this large, CPU unit storing, billions of bits of data. And it does store a lot of information, but it doesn't store it like a library. It stores it more like a file on our desktop. And so what happens when you open up a Word document and you look at it? Well, you edit it, right? You go, oh, yeah, I remember that, but oh, I remember this too. Oh, that wasn't so important. Maybe I don't even need to think about that. And memory is malleable. So every time we kind of pull that file up, we have the ability to change that. Now, sometimes it doesn't change. We pull it up and we go, yep, that's exactly how it happened. And that's exactly how I remember it. And we put it back just like it was. What ART does is we pull that file up and we out process the images and the sensations, the reactions in your body that are associated with that memory. We have 5 different places in our brain where memory is stored. There's a special place for traumatic memories, and then there's more places for non-traumatic memories where we just look at where information is stored. It doesn't have an emotional connection necessarily. So if I tell you, what's the capital of North Dakota, right? That part of your memory is different than tell me about the worst day of your life. You're going to different memory locations to pull those out. But memory is malleable. So if we can process it, if we can work with it, and we can have you see it differently, then just like when we hit save on that Word doc and put it back on our desktop and close it, it's now different. And that's really the technique and the mechanism in which many of these new therapies are working. They're working with that concept of plasticity or elasticity of the brain, that we can change it, that it isn't a book that's written, it's a file that can be modified. And then if we put it back differently, it will stay different and it will be stored new and potentially even in a new location. So voluntary image replacement with ART is working on that memory center of the brain, cleaning out the distressing parts of that experience, and then putting it back in that information center of the brain where you remember it, but it just doesn't cause you to become upset. So I can remember every flat tire that I've ever had on the freeway. And I know at the time I was really upset by those experiences, but I can't say right now that I feel upset when I think about it, right? And that's because my brain doesn't associate that as traumatic. So it's just sort of saved the remembering that it was a problem at the time, but it doesn't feel bad now. And that's how we shift out of trauma and into a healthier type of memory. So going back there 1 second. So ART is a therapy that I use, and what's really great, these are my two favorite things about ART. For PTSD, the research that's been done shows between 3 or 4 sessions of it is all you need to cure your PTSD. So notice the other ones were weeks or months. This is 3 or 4 sessions, and you can expect full recovery. So the research that's been done shows that it's able to get the same amount of relief without the re-traumatization and in a much shorter period of time, which means less time, less money, less investment, and just as much benefit. It's also covered by insurance because anybody who practices ART also has to be a licensed provider. We only train licensed mental health professionals to do ART. So you know that you're going to be able to utilize that benefit that you have, and you're not going to be there very long, and it's not distressing. I study moral injury specifically, and one of the things about moral injury, it's this idea that something happened, either something that you did or that you saw someone do, and it was so distressing that you can't even talk about it. You don't want to talk about it. Maybe there's tremendous shame or guilt. And ART, you can come in with a traumatic memory and you don't have to tell the therapist what you're working on. You don't have to have a relationship with the therapist even. We're working with your brain. So I'll ask you to see the image of what happened, see the memory, and then I'll ask you what you feel in your body. And I've done lots of ART sessions without ever really knowing what the person was processing through. And for some folks, the idea that they can heal without having to share or work through that shame and guilt can really offer them a treatment that they can't get anywhere else. So let's talk about TMS, transcranial magnetic stimulation. It's a non-invasive procedure that uses magnets to stimulate nerve cells of the brain. It's typically was used for depression, but there is a little bit of research out there showing that there's support for post-traumatic stress. Just a couple of studies, very small. It's not going to be covered by your insurance typically, but it's not a long-term thing that you need to do forever. But there really just is not a lot of research on it yet if it's going to work for PTS. But the one study that was done showed a lot of promise. It actually seemed to be really, really good. But I'm not always a trusting person. So when it looks too good to be true, I'm a little bit nervous about that. But I do have one client who had previously done it and found it very, very helpful. SGB, or stellate ganglion block, that's something that the VA actually just developed and researched. And what they found is that PTS symptoms decreased by 80% in the patients in the study. So there's some current trials ongoing. It's rapid relief, but it requires a medical specialist, and it's not typically covered by insurance. What they're doing is they're going in and they're basically paralyzing a nerve in your neck that is responsible for that parasympathetic nervous system activation. And blocking that feeling of fight or flight can give people relief instantaneously from profoundly disabling PTS. There's some cool documentaries out there and YouTube videos too, if you check it out. But it's hard to find. And mainly what you're going to do is go to a pain clinic, a large hospital pain clinic. They'll be familiar with doing that procedure because there's other medical problems that procedure is used for, and they'll have more experience. Yeah, Lisa, if I get more time at the end, I will talk about it. Neurofeedback has been shown to produce significant PTSD symptom improvement in individuals with chronic PTSD. Typically takes about 20 sessions. It's painless, it's drug-free, and it's covered by some insurances. It's not a talking therapy, and there's very limited research, but the research that's out there has shown that it's been very, very effective. Brain spotting is a focused treatment method that works by looking at the sources of emotional body pain, and then they work with your visual field. So the practitioner would be sitting in front of you and they would be moving their finger and they would be asking you if when you think about that thing that is bad, where their finger moves, does it get better or worse? And they find the spot in your visual field that seems to be where visually the memory is stored, and they focus on relaxing your body. Brain spotting doesn't have any research that's been done in the United States on it. It's been around since about 2005. And so it's very hard. There's very few people who do it. And the lack of research, this one probably has the least amount of research out of all of them. So I'm a little bit more cautious than normal about recommending that. So let's talk about psychedelics. Everyone's talking about psychedelics. If you look at the bottom here of this slide, there's an interview that will get, or an article out of Nature magazine that will show you and teach you more things than you want to know about the topic. But they're looking at ketamine, they're looking at MDMA, they're looking at psilocybin and LSD. And what they're finding is that probably what's happening is these medications do sort of prime the brain to increase that plasticity or that flexibility that allows the brain to change how it feels about something or to create new memories. So what happens in these treatments is you're kind of put into an altered state of mind, and sometimes you can come out of that feeling much differently about your problem, about your situation, about your body. The problem is ketamine is a prescription anesthetic. It's available in the United States, but MDMA is highly regulated, and LSD and psilocybin and all the other ones are illegal. So getting access, getting, an actual known, do you even know what you're getting is kind of the problem. Dosing for people, it's going to be given to you by a non-medical professional most times. And that's going to be something that makes me a little bit nervous. Oh, thanks, Kate, for linking the article there. I appreciate it. So one of the things that we found with psychedelic treatment is that sometimes people get better really fast, like they walk out feeling completely healed. And that can be really disruptive if you weren't expecting it, to feel suddenly like such a difference of who you are from one moment to another. That can cause kind of refractory anxiety, as we call it. So that's something that I just want you to be aware of. But there's a nostalgia for psychedelics right now, and they're doing all kinds of clinical trials, and they're looking at it for all kinds of different medical conditions and psychiatric conditions. So maybe in 5 or 10 years, treatments like this will be more readily available and they'll be standardized. But right now, ketamine seems to be about the safest bet if you're interested in that, because first of all, it's not illegal, and it's going to be given by a physician who's licensed only. So there are ketamine clinics throughout the United States. And at the end of this presentation, you can see, here's my information, here's some resource information, and then there's links on here, where to find an ART therapist, how to connect with your local VA, how to find a ketamine physician, who's doing TMS and the SGB. And then there's also a link in there for how to find an EMDR therapist. So I'm going to go back to your question, Lisa, about how art works in such a short period of time. Well, the reason why it works in such a short period of time is because we're working with the brain and the memory. So just like if I said, Lisa, edit this file for me, well, you're going to edit the file and you're going to put it back. You don't need to keep editing it. You just, once you've moved those sensations and once you've gotten rid of those distressing stuck images, they're gone. When we put it back, they're gone. They don't come back unless that same thing is re-experienced, which is highly unlikely. So that's why ART works fast, is because we're working with the brain and the memory system. And the way that the patient is editing their memory, they're going to keep the full memory of exactly what happened. So whatever happened to you in the past, you will remember it the same when you walk out of an ART session. What you won't experience is that same level of reaction when you think about it in the future. Just like I said, that like the flat tire example. In that moment, I was probably pretty pissed off, right? But when I got home, I was over it. Now, when I think about it 3 years later, it doesn't bother me at all. I remember it, but it doesn't bother me. And that's how we work with those traumatic memories. We edit out those distressing images. We edit out those somatic reactions in the body. And when we do that, the brain doesn't recognize it anymore as a traumatic memory, and it puts it back in that kind of healthy space where just information goes. So we're not erasing anything permanently. We're just removing some of the distressing aspects of it emotionally. Oh, the use of therapy animals. Therapy animals are great, especially with PTSD. I have a dog, his name is Sailor, and he's the best thing ever. And having a therapy animal present, whether it's your own or an animal assisted therapist who works with animals and you, or equine therapy, all of those have been shown to have really positive effects. So there are people who do work with horses and with dogs and even with cats for therapy with animals assisting. And the research on it has always been very, very positive. Okay, I really appreciate you guys being here. And I'm going to give you just a moment to take down my information. That's my cell phone number. Call me. That's my email. So email me if you've got more questions, if you wanted to ask a question, if you want follow up and support or any kind of advice or guidance. I'm here for you, and I care about you guys, and I want you to be well. I know what it's like to live with PTSD, and I want to encourage you to get help. I personally have done traditional therapy, cognitive behavioral therapy, ketamine therapy, and ART, and I was not able to get a long term relief from my PTSD until I did ART. So that's what made me want to have a passion and learn how to do it so that I could give that to other people. So thank you for being with me and for being so attentive and for your great questions. And yeah, please get this PowerPoint and hold on to it. It's a good way to kind of ask questions. And remember, it takes a really brave person to ask for help. It's not a sign of weakness. It's proof of your courage. Thank you.
Thank you so much, Melissa. And thank you, everyone, for joining us today. And if there's anything I can help you with as well, please reach out to me. I can help connect you, get you EAP therapist or someone that does the art. And we have very limited resources here in Michigan right now. We only have 5 therapists, but there are more people being trained. So um, it's a great technique. If, like Melissa said, you've tried other things and it's not working, this is just another option for you to try. But we thank you so much for joining us today. And it will be recorded if anyone knows anyone that couldn't see it today and wants to, that can also view it later. So have a wonderful weekend, everyone.